Hey everybody, so this video is going to be on how I became a dental hygienist. It's going to kind of tailor off of the last video I made, but probably just be a little bit shorter. And so yeah, first things first, just graduated from high school. I went to a community college where I live and did some prerequisites, a lot of them science-based, like microbiology, chemistry, anatomy. At this point, I still wasn't really sure what I wanted to do. I was looking into like nursing, dental hygiene. I looked into radiology, and I did some shadowing, and I was like, you know what, I think dental hygiene would be really good for me. And so after I finished, I looked into the program that was located close to me. It's called Old Dominion University. They have a bachelor at dental hygiene program, and I was following their checklist, and so I finished the prerequisites at the community college close by. About 2 years of that, I applied to the dental hygiene program, somehow got in on the first try. I don't know, I guess I got lucky, but you did have to do like an essay as well, and they do have like a really high GPA standard. I think mine was like 3.8 or 3.9, somewhere in that range. But yeah, they do prefer like a higher GPA for the program. And so yeah, went into the dental hygiene program. That was 2 years. There are like an associate level associate level dental hygiene programs, which is the majority of them. There's not a whole lot of like bachelor degree ones out there. I think the main reason I did this program was because it was close by. But you can do a little bit more with a bachelor's degree program. You can do public health, you can do research, you can educate, be a professor at an associate's level. So like if I wanted to go teach at a college that teaches dental hygiene at an associate's degree, then I can go and do that. So that is a nice little perk. Pay grade obviously is not going to be the same, but it's nice to have options if you don't want to just do clinical. But it doesn't change like your pay much. I mean, you could probably use that as like a wager, like higher education or more advanced education. But with all that being said, yeah, I went to the dental hygiene program at ODU, did the 2 years there. I'll probably make a whole separate video on like dental hygiene experience in school, because that's a whole thing. And then after the program, we had to complete a few exams, our board examination. That one's probably the toughest one, hefty in price. We had to do like a clinical exam where we actually did them on mannequins, because when I went through the program, it was like COVID time frame, and so they weren't doing live patients anymore. The mannequin's weird, I'm not gonna lie, but it also saved us from having to find a live patient who could back out and cause us to fail. So that I'm forever thankful for, because I couldn't imagine like if I had to do that. Anyway, so yeah, you had to do that, and then you had to take your state licensure exams, of course, for whatever state you want to be licensed in. And then it takes a little bit it takes a little bit to get your actual license. I want to say mine took like maybe 6 weeks to 8 weeks to get totally processed. But yeah, and then I got my license, and now I practice as a dental hygienist. So that's pretty much like the flow of how I got to becoming a dental hygienist, like the schooling and everything. What was I gonna say that was pretty important? I don't remember what I was gonna say. I wanted to mention like the financial part in terms of dental hygiene school. So for me, going to a community college, it allowed me to save a lot of money. Like I paid off those loans while going to school and working. And then when you go to university, it's obviously going to be a bit more expensive. And so for the bachelor's degree program, it is going to be more costly long run. So if you want to do just clinical, then you could probably just do, an associate's degree in dental hygiene. Their programs tend to be a lot smaller too, though. I think my class was like 35 or 38 of us. I know a lot of the associate level dental hygiene programs only take like 10, 15 students. So those are probably just as difficult to get into as the program I went to. But yeah, if you want to like save money in doing this and you want to do just clinical, then I would definitely probably do an associate's degree level. But if you want more expanded options, then go the bachelor's route. But I think that's pretty much everything I wanted to hit. this was just basically like a quick little summary of where I started and how I got there and where I'm at today. So yeah, I'll make some more videos.